CDH Awareness Day. Please donate and help these kids out. Be well.
Okay, welcome back to the telethon. Here we have Hope, my friend, that has a cherub. Her son's name is Gage, and I'm Hope, and look at my shirt. Look at my shirt.
It's perfect.
I wear
Yes.
a Hope shirt.
I need to get one of those.
Yeah, we're kind of in our own club, right? Like Hope moms in Utah with boys that are amazing.
Yes.
You know, I'm just saying we should get some t-shirts made or trophies or something. I don't know. I don't know. Okay, so start from the beginning. I want to know right from the beginning, how did you find out about CDH? How had you ever heard of it before your diagnosis? Kind of give me a rundown of how it went, how you learned about it.
So I actually worked at the hospital before I started having kids. I worked doing the birth certificates. So I would go down, collect all the birth certificates, and then I also filled out the state information that got submitted along with all the birth certificate information. So when I did that, there was actually a form of like a whole bunch of issues that babies can have. And I had only ever marked CDH once at the hospital that I worked at. So I was one of the 15% that did not have the diagnosis until after I delivered. And so when we did find out and they told us that's what it was, my mind went back to when I was filling out birth certificates. Because at the time I delivered, I actually worked in labor and delivery. I was no longer doing birth certificates. Oh, wow. So I was aware of what the name was, but I didn't know any details past that point other than just the name. And it meant that the baby got transported to primary children's. So.
And that was it. That's all you knew.
Yep, that's all I knew.
Wow.
So
okay, so how far away was the hospital that you delivered at?
So, I mean, it depends on traffic, of course, but it's probably about an hour and a half from the hospital that I delivered at. Oh, so wow. I happened to deliver after 6 p.m. And by the time they had done all the tests and figured out what was wrong, it was probably closer to 9:30. So rather than having the helicopter come and transport my baby, they were able to ambulance him, which
just get him right up there.
Yeah, because he was stable enough to get up. It was really weird. As crazy as it was, they're like, he's stable. Like they didn't even intubate him until they got to primary children's because of how stable his breathing was.
Wow. That's incredible.
Yeah.
Wow. So how did you find out how serious this really was? Like what was that moment like?
So I was watching one of your other interviews and I actually had that thought of like, when did it hit me? And I remember delivering, I remember finding out the diagnosis and the transport team taking him, and my husband followed the ambulance up to primary children's, and I, of course, had to stay at the hospital I was at. And I'll be honest, it didn't hit me until probably 3 o'clock in the morning when everything was quiet. My friend actually stayed with me at the hospital, and it was one of those, oh my gosh, one of those like out of body experiences. Because after you deliver a baby, your body is just kind of, especially your first, you have no idea what is going on. You're kind of in like a euphoric state of what did my body just do and everything. And so it wasn't until that quiet moment at like 3 o'clock in the morning that I was like, this is real. This is really what just happened. Like, this is not a dream. My baby's not here with me. I think that's the moment that I was like, my baby's not here. Because the nurses were coming in, they're like, you got to pump. Like, even though your baby's not here, you got to get that process started. And I was just like so overwhelmed with, well, my baby's not even here. My husband's not even here with me. Like, my friend was asleep, of course, at 3 o'clock in the morning. I was grateful she was there with me, but it was just one of those, oh my goodness. What, like, and with the diagnosis, you never know. No one can give you a straight answer. You don't know the extent. You don't know. You can't plan for anything. You just don't know what. Every time you ask a question, it's, Well, we don't know the answer to that yet. We won't know until this point.
Every baby is different. Every outcome is different.
Exactly. We won't know until we do surgery. Exactly.
Right. So that's hard.
Yeah.
So how long after birth until he had his repair done? How many days?
It was actually 3 or 4. He was stable enough that he kept getting bumped off of the surgery list.
Really?
So,
wow.
Yeah, because they're like, he's stable, he's doing fine, and there's other priorities that need to be done in surgery. And so it wasn't until I think 3 or 4 days later that they were like, okay, we're doing surgery today at 2 p.m. And we're like, oh my goodness.
Okay,
it's finally, it's happening. So we're calling our parents and we're like, you guys got to get up here. It's finally happening. We're finally going to get some answers at that point, because they still at that point, they're like, we don't know where his liver is. Like, we don't really know what's going on, but he's stable. I'm like,
right.
Awesome. Okay.
Oh, wow. So tell me what it was like when you had to leave him for surgery. Did he have surgery there in the NICU, or did they take him to the OR?
They actually, well, now, I mean, it's been 8 years. I'm like, shoot, I got to think back to, because he had surgery to repair it, but they left him open. And so then he had a second surgery to close him days later.
And sometimes they have to do that. That was something I didn't know about before we had our son. I didn't know that sometimes they have to leave him open. So that's good that you're talking about that, because that can kind of prepare some parents and families that maybe that might happen, and not to be scared of it. I mean, they just simply need a little more time to squish everything in there. So
yes, they told us that it was to prevent compartment syndrome, which when you think about it, totally makes sense.
It does.
So I'm pretty sure he had both surgeries in the actual room. I don't think they took him down to the OR for either of them. Seems like they moved babies out of the room so they could do it right there at the bedside.
Right. That's how ours was done too. So what, after surgery, when they were able to give you more answers, how was that? Was that hard for you, or was that a relief? Like, is that when you realized how sick he really was? Like, what was that like?
So it was actually a relief, because basically we went into it and they're like, we won't know anything till surgery. We don't know what all's up in his chest cavity. We don't know how much diaphragm he has. Like, they basically tell you, we don't know anything until we get in there. And so to have them come out of surgery and be like, only 30% didn't develop. So we were able to close and not use mesh. We were able to move everything back down, and to have them do the x-rays. So they did x-rays on Gage right after they closed him. Well, not right after they closed him, after they moved everything, just to see how much of that lung was there. And to see that first x-ray of an entire lung was like the biggest relief, because they're like, we don't know when this happened during your pregnancy. We don't know how much of his lungs didn't develop. And his heart had shifted before. And so after surgery, it shifted right back. The lung inflated, everything. It was like best case, worst case scenario for the situation. So,
wow. That's
so
crazy.
it was a relief. And it was nice to finally see him after surgery, because I feel like they kept him very sedated before surgery just to help his body relax. And then, even though he was still open and they were taking him off of his meds, to finally interact with my baby. Because I'll never forget, the first thing the nurse said to me when I saw Gage, I started to rub his foot, and she's like, oh, don't rub his foot. That'll irritate him. I'm like, don't say that to your mom. I haven't seen my baby at all. This is the first time. It's one of those things, you probably snap at some of those nurses a little bit too much. And I hope they've learned that it's called postpartum hormones.
I think they know.
Yeah. So
I think they know.
it was nice to finally see my baby being a baby, even though he was just
Yeah.
laying there, but actually to be moving. And
Right.
yeah, so
Right. That's exciting. So how long was he in the NICU before you guys got to go home?
so he was actually only there for 3 weeks and 1 day,
Wow. Wow.
which it probably could have been longer, but I tried breastfeeding, and every time I tried breastfeeding, it never counted as a full feed
Oh.
because they have like their requirements for it to
Right.
count as a full feed. And I never hit that point. And so I talked to my husband. I'm like, I just want my baby home. Like,
Right.
being at the hospital every day during my maternity
Right.
leave when I work at the hospital is not an ideal maternity leave. Going from
No.
hospital food to different hospital food, nobody wants that.
No.
So we made the decision to bottle feed to get him home. And so
You kind of
as-
just have to do what is right for you and your child and your circumstances. Right?
exactly. I mean,
Yeah.
the freezer was already full of all my breast milk from pumping. So I wasn't formula feeding. So I hope no
Yeah.
mom ever feels guilty for that.
No.
But I kept telling my husband, I'm like, we'll figure breastfeeding out when we get home.
Right.
I just want him home. And amazingly, he did both. Like once we got home and adjusted,
He was okay.
he was okay feeding either way, which was
Wow.
perfect because I went back to work full time after 12 weeks. And so it just worked
Wow.
out. So
Wow. Well, now here we are. We have this 8-year-old, right? He's 8.
yes,
right?
he just turned
Okay.
8.
Okay, I was like, wait, I think he just had a birthday. Okay, so he's 8 now. Have you noticed any limitations on, is he slower than the other kids playing? Is he delayed at school? Are there any things that you can kind of tie to CDH? How's that going?
There's not. He has been healthy ever since. He's actually my child that doesn't get a whole bunch of colds or anything like that.
Wow.
All my other kids are the worst he's gotten is an ear infection. I don't think he's ever
Wow.
had croup or anything like that like the other
Wow.
kids.
Uh-huh.
The only noticeable difference that I can link back to his diaphragmatic hernia, it's not even, I guess, related to that. He did end up with a bowel obstruction 10 days after we got home. And so
great.
we were right. Well, and it was hard because you go to the hospital because I'm like, something's wrong with my baby. Like,
Right.
we just got
something's not right.
home.
Mhm.
He's not keeping anything down. And by the time we took him to the ER, he was like lethargic.
Oh.
And they're like, oh, he's probably got meningitis. I'm like, I don't think that's what's going on. That was a really bad hospital experience. We won't talk about that. But we ended up getting transported back up to primary children's. They drained everything out of him, trying to figure out what's going on. And it turned out all the scar tissue from his repair had attached to the fatty layer inside of him. And so they did end up having to go in for surgery, detach all the scar tissue. They actually removed, it's called the omentum. It's just the fatty layer that protects all of your bowels. They
Right.
removed it completely.
Wow.
It had been kinked off for so long that they actually had to cut into his intestines. And so they removed his appendix at the same time to
wow.
make sure they closed his bowels completely for that.
Uh-huh.
And so because of that, he's actually very skinny.
No.
He is my child that
Uh,
poor kid, he's got no waist on him at all. And I don't know if he ever will. And there's going to be a day when his 6-year-old little brother wears the same clothes as him. Because
maybe.
exactly. So he's small, and I can only relate it to the fact that he doesn't have that fatty layer. But
Uh-huh.
other than that, he eats like he eats more than I do half the time.
Wow.
So
Wow.
he just
So
gets his annual chest x-ray, and that's it.
And that's it. But you do an annual chest x-ray. Your doctor
Yes.
keeps on top of things.
Yes.
That's good. So tell me, when it was time for him to go to school, you don't homeschool, do you?
No, no.
Okay, he goes to school. Okay,
Yes.
I shouldn't assume that you send him to school. So when it was time for kindergarten or preschool or whatever, how did you get through that? I know that can be that can really induce anxiety. What helped you get through that?
So on every document, I explained what he was born with. So that way, if on the playground something happens or anything like that, they can go back and look at his medical form that I filled out and be like, okay, he's had a diaphragmatic hernia. And so I fill out those forms with every detail of this is what happened, this is what happens. And so
you've educated his teachers and office staff and stuff like that, and that's helped you?
Yes, it has. And
That's
so
good.
it's funny because he's very aware of it too. So when he does show and tells and whatnot, he'll take a picture or he'll take the stuffed animal that he got while he was at the hospital. And so he does also educate the kids around him. And it's so funny because I feel like as a mom of a child with CDH, it's so normal to you. Like I'll go to the pool and not even think twice. And people will like be staring at us. And I'm like, oh yeah, he's got a scar across his stomach.
A scar.
Like that's why people are looking at us like, because it's just normal to you.
Right.
So.
Right. And like for us now, Tyler's 17. If I see a boy with his shirt off that doesn't have a scar, I'm like, yeah, there's something missing there.
Well,
it's
and
funny
like
how it becomes our new normal.
Right. And like Gage has little brothers and they're like, well, where's my scar? I'm like,
where's my?
You didn't have surgery, so you don't have a scar. So
you don't get a scar.
Yeah. I have noticed that if he overeats, he will complain about pain around his scar. So I wonder if he's just got some like residual scar tissue that if he eats too much fiber or something, it just rubs it wrong. I have noticed that. So I'm like, limit your carrot intake because usually it's carrots that
really
make him uncomfortable.
And that's good that you're aware of that. And if there's something, that you're uncomfortable with, then you can go to your doctor and say, let's check this out.
Exactly.
So that's good that you're on top of that. So tell me, when did you hear about cherubs? How did you find cherubs? Do you remember?
Yes. So it was actually that 3 a.m. when I was all by myself in the quiet, dark room. And it was finally, I was to the point of, okay, I got to Google this. Like, I got to at least mentally prepare for what's coming a little bit.
Right.
And so just the best is when you Google CDH, cherubs is one of the first links that pops up. So it was nice to look at that. I definitely recommend reading the positive stories first before you look at the sad stories.
I know.
Because it's hard to go between them both when you're just in that unknown state of what's going to go on. But I immediately registered because I knew we were now part of that community. And it was actually nice. I'm pretty sure it was a week before we got discharged. I'd already gotten my care package with everything.
Wow.
So it was one of those refreshing, like, oh my goodness, like I had no idea a care package was on its way. But it was very refreshing
about us.
Exactly. Like I'm not just a number that's on their list of people that are on this website.
Certainly you are not, for sure. So when was the first time you met another family? Was it at the conference? Was that the first time you had met other families with CDH?
So it was actually probably 6 months after I delivered Gage.
Really?
There was a family that came in to deliver at the hospital, and the nurse came out and told me that their oldest was also born with a diaphragmatic hernia. So you're instantly connected, right? So I remember going in and talking to the family and hearing their story, which everyone's story is so different.
So different.
So hearing their story and how And it's hard because mine was undiagnosed. I do
Mhm.
not tell people that right off the bat,
Yeah.
because especially if they're in that state of I'm pregnant again, my baby's doing great.
Right.
I don't want to give them that fear of, oh my goodness, it's possible. Because with having kids after and going to have extra ultrasounds and whatnot, they did explain to me that there are things that show up on the ultrasound that would tell
Mhm.
us. So
Wow.
it made my other pregnancies very comforting, because they informed me of what they were looking for and what they were
Mhm.
looking at. And
Uh-huh.
even with Gage, because I worked in labor and delivery and I was
Mhm.
friends with all the OBs, they
Mhm.
all went back and looked at my ultrasound, and they're like, your ultrasound looked perfect at 20
Really?
weeks.
Wow.
They're like, there were no indications.
No signs.
Yeah. That being said,
Wow.
the day before I delivered, I did slip and fall in the snow.
Mm.
And so my mom, while we were at Primary Children's, did say, are you sure your fall didn't cause this? You don't say that to a postpartum mom, ever. I
Bless
snapped
her
at
heart.
her. I know. I'm thinking back, and like, she was
gosh.
not saying that in any
She
negative
was
way.
not meaning to hurt
But
you. Right.
but that being said, it's possible that that's when it actually pushed
We're always
everything
just
up.
looking, right? We're always looking for what did I do? What happened? And
Exactly.
the bottom line is we don't know yet, and that's why research is so important. That's why surveys are so important. There's a lot going on that we have to participate in to help with the future of CDH, so we can find out why this happens and how to prevent it from happening if at all possible. So
Yeah.
we have a lot of work to do.
Yes.
Okay, well, you know what? I am so glad the two Hopes and my Hope shirts got to chat today.
Yes.
It's been awesome to talk to you. I appreciate you joining us for the telethon, and I just want to tell you good job with Gage and your other kiddos, and you're doing a great job. We really appreciate you, being part of our Utah Cherubs group and just encouraging people every day. So you're doing great, and we appreciate it.
Thank you.
All right, it's good to talk to you, and thanks for joining us on the telethon, and we'll talk to you next time.
Hi everyone, this is Matt Roloff with Little People Big World. I'm here to bring your attention to a very important cause. April 19th is International Congenital Diaphragmatic Hernia Awareness Day. CDH affects 1,600 kids a year in the U.S. With a 50% survival rate. So it's CDH Awareness Day, April 19th. Please donate to help the kids. This video is helping support a charity telethon. So open your wallets and help these kids out. Thank you very much.
Hi, my name is William Wisher, and I write motion pictures, such as Terminator 2, 13th Warrior, and I rewrote and produced Live Free or Die Hard, and a bunch of other stuff. But I'm really not here to talk about me today. Today is International Congenital Diaphragmatic Hernia Awareness Day. I know that's a mouthful. But CDH is a congenital deformity where the diaphragm is a hernia in utero. And this means that the lower organs migrate into the chest cavity, and the lungs and the heart cannot develop. These babies usually die within minutes of being born, and the ones who live have astronomical bills, as much as $1 million a month. We need to end this disease. My first wife and dear friend to this day lost her son to CDH. He died in less than an hour while she held him in her arms, and I can tell you personally how devastating that was to her and her husband and her friends and family. CDH affects about 1,600 babies a year in the United States alone, and many more worldwide. we lose a baby, an infant, to this disease every 12 hours. Now, today, we are trying to raise awareness about this terrible disease. So please go to cdhi.org and donate today so that no child will have to suffer another death from this terrible disease, and no parent will ever have to endure the emotional trauma that death brings. Thank you very much.